What's up, everybody? Welcome back to another episode of Just Saying. Today we're gonna try our best to not have casual sex because we will be talking about Hey guys, so today we're gonna discuss HIV, but of course we are not professionals to answer your questions or anything along those lines. So we invited a professional, Dr. Martin Chio from DSC, to answer all our questions on HIV. Maybe you can explain to us what HIV is and what does it do to people?
So HIV is a virus, okay, that is you can get easily infected, and then it breaks down your immune system, and then after that, other things happen because of that.
What's the difference between HIV and AIDS?
HIV virus is the virus that gives you the infection, and then if this virus is not detected or untreated, then the patients can develop symptoms of AIDS, which is the downstream effect of HIV.
So it's like a long-term HIV?
Yes, it's long-term HIV in which various conditions, for example, infections, cancers, and other things can happen along the way.
So if I have HIV, I will definitely get AIDS, or?
Oh no, perhaps in the early stage, in the early times when there wasn't a treatment, but when there's treatment available, you can definitely prevent progression to AIDS. So the earlier you detect, the earlier you treat, the better the outcomes to prevent HIV becoming AIDS.
I believe that some people have said that they cannot have HIV or AIDS if they don't have multiple sex partners. Is that entirely true?
Technically speaking, if you encounter one person with HIV who is undetected, untreated, the risk is there. By having multiple partners, you just increase your risk. But it also depends on the number of people in that particular group.
So it's also common knowledge that it's passed through sexual intercourse. Is there anything else?
Okay, so locally in Singapore, HIV, the commonest one is through sexual intercourse. But there are other ways of acquiring HIV. For example, 2 ways from mother to child, okay? Or through breast milk if the mother is breastfeeding. Okay, and the other thing would be if people share things like needles when they do intravenous drug use.
So if you get a cut and then another person has an open wound, can you get HIV as well?
Potentially, if there is fluid to fluid contact, yes.
Okay.
Also, if the
blood touches the blood.
Yeah.
Blood drips on an open wound. There is the possibility.
Okay, I saw this episode of NCIS, or was it CSI? Do you guys watch CSI?
No.
Yes.
And they figured out who the killer was because the guy he killed had HIV and the blood went into his eye. And then the killer had HIV. Is that possible?
It is a possibility, but the virus is very sensitive. It doesn't live outside the body for a very long time. So it has to be nearly immediate and nearly
Yeah, it was. He like stabbed him in the
When you
blood.
say very long, it's like what, a few seconds?
Few seconds,
okay.
a few minutes, depending on, because you need warmth, you need everything else.
Sorry, my eyes is an open wound?
No, for
No, it's like a membrane. That's
Yes.
why.
Okay.
It's open.
anything that's wet, for example,
liquid
the
to
eyes,
liquid,
right?
mucus layer to mucus layer. Oral is also mucus layer.
Okay.
Okay, and then of course the genital area, be it from the urethra or the anal areas, all mucus layers, you see. So skin is wonderful. Skin protects. You splash, it falls off. But once there's a break in the skin,
Okay.
anything can get in.
Basically, the blood just needs to enter your body.
And the same for STIs also. For example, mucosal layers, okay, there is not much protection. If you have a small ulcer, a bit of gum bleed, a bit of bleeding, okay, that becomes a potential portal of entry.
So oral sex can give AIDS, HIV.
Okay, so imagine that you
This is so
have
graphic.
just brushed your teeth
Okay.
because you want to have
Oral sex.
you want to clean teeth.
Why do you? Okay, wait, just wait. Do you clean your mouth before you have oral
Maybe
sex?
the guy like hot and cold or what?
So for example, when you brush your teeth, okay, if you are very enthusiastic about it, you may have micro cuts, micro tears, and then you have then becomes a potential entry.
Why do you guess?
Oh no,
Why
because
do you
I
have a
really
lot?
brush my teeth.
I can tell.
I really like.
Gargling may be a better option rather than brushing your teeth because it's definitely less traumatic. If you want fresh breath, and then the minty sensation that you may want.
If I brush my teeth vigorously and I create a cut in my mouth,
Yeah. And then
I give oral sex.
yes. Then,
It will
for
happen.
example, if there's exchange of bodily fluids will include pre-ejaculate, okay, or what people call it pre-cum, or ejaculate itself, or cum itself,
Okay.
then there's also a possibility.
And this goes for the woman as well.
Yeah,
So
the vaginal fluids, cervical fluids is the same issue. And if there's a small cut, okay, there's always a risk. But having said that, oral sex in the current codex usually leads to some sort of penetrative sex. So that the risk is there nonetheless.
So is there any difference between men and women when it comes to passing HIV?
It really depends on where and how the sex takes place. We have talked about oral sex. Okay? If there's vaginal sex, okay, the mucosal layers inside there increases the risk of penetration.
So it's actually the girl's getting more wet.
Thank you.
Okay.
IT student lah.
The same goes for the anal. If you engage in anal sex, okay.
I
So
don't know
your
this.
anus can be wet also lah.
Can?
What?
Yeah, there are glands and secretions there too.
You know?
Yeah. It's not a done deal that if I have sex with someone with HIV that I will get HIV, right?
No, you must also remember that if people are HIV positive,
They can be like not like active.
if they are on treatment
Yeah.
and they are well suppressed, very low viral loads or undetectable viral loads, and then they are untransmissible. So the WHO has been going on and educating people about undetectable equals untransmissible.
Okay.
So
So
that's
it's-
why being detected early, being treated early, being followed up, okay, leads to being safer overall.
So is there a done deal where undetectable equals untransmissible?
The studies have shown that this is definitely
Okay.
situation.
There's a lot of work a long way to go with like this destigmatizing it,
Yes.
because we've just come up with a whole laundry list of things, ways that you can, you kill someone and you can get HIV, you kiss someone and you can get HIV. But
Yeah.
then if it's detected early
Yes.
and treated,
Yes.
then you can kill them safely and kiss them safely.
I'm not sure about killing people.
No, I mean,
What about mosquitoes? So if mosquito lands on me and I have AIDS, bite, then go to Saffron.
Oh.
can I be so honest? I literally thought that the Aedes mosquito spread
Was-
AIDS
Oh,
Oh wow.
and
for
the
like
it sounds
a
the same.
really long time.
Oh okay.
I mean, yeah, a fair assumption.
Yeah,
because
But-
and they have like long legs and shit. They look like they spread AIDS lah.
Long legs, what?
I mean, mosquitoes
Yeah.
do spread malaria. Actually.
Yeah, malaria.
They also
Okay.
spread dengue, which is another thing. But in the terms of HIV itself, if someone is HIV positive and is bitten, okay, they can't spread this particular virus. So no, mosquitoes are not a vector for
because
HIV.
they cannot carry it.
Yeah.
Is that why?
Are there certain behaviors and lifestyle choices that increases the chance of getting HIV?
Yes,
Good question.
for sure.
Right?
Okay.
Are you a hoe?
Let's hope it's not one of our lifestyles.
If you have sex when you are under the influence of alcohol, that
Wow.
impairs your cognition.
So we come to the end of this episode.
As in, it impairs your cognition because people don't partake in wearing condoms?
A few things, okay? So partner choice might be one thing, okay?
Oh, shit.
Okay, if you're
No,
drunk,
that's
you may
interesting.
not use
Yeah.
a condom. Okay, if you're drunk, you may not talk about, hey, have
Do you have
been
STDs?
screened, have you been screened, have
you
you
won't
been
have
treated,
the
and stuff like that.
conversation.
People can lie as well if you
Yeah.
do ask.
Yeah.
So.
Okay, and then after that, this is the casual sex you can potentially have. Okay, therefore, then you can potentially pick up something. Okay, if not HIV itself, maybe a common STI like chlamydia or gonorrhea or syphilis.
Yeah.
For as long as you are not in a stable mind.
Yes, and
Okay.
that also happens. Alcohol is one thing. So for some people, they engage in sex when they are under influence of other substances. That is potentially a risk also.
So my question to you is, okay, this is very relatable to us, especially because we party a lot, and
Speak for yourself. And
we
yes,
use
and
party a lot. Yeah, it's good. Saffron parties a lot, and how do we tell if someone has HIV or not? Based on my knowledge, cold sores is
No,
one
that's-
of them.
So
It's like most STDs. I mean, like you would kiss a guy with cold sore, man. You asking for
But
it?
cold sores can come up anywhere, no?
Like you dude. Like imagine there's one on the face like so.
So you
You
kiss
make my jaw like not that you
Okay.
have STDs, but like gross.
okay, so when you're partying with masks, you won't know. But now that we can see,
No mask.
yeah, cold sores, but you can have a small little wound on the upper lip or
Okay.
anywhere on the lips itself.
Okay.
Okay, and then that is caused by a herpes virus.
Yeah, herpes.
Okay, so anything that is ulcerated, okay, potentially puts you at risk of transmission. and of course acquisition. So coastal viruses and oral herpes is actually one of the commonest things, okay, that people would have in locally and internationally. And if you have an active ulcer, you can also acquire other viruses.
Okay.
That's why genital ulcer disease or any sort of ulceration that we have is a portal of entry into our system.
Okay.
I've heard stories of people getting herpes, then gonorrhea. Like in London.
I heard herpes is like really very, very, very common.
Common, yeah.
Yeah,
it is.
it's pretty common.
Although, is it really
It's
an STD?
Yeah, so herpes you can actually acquire quite
Like
easily
A or
because
B.
it's skin-to-skin contact, and of course, even if your skin is normal, you can actually still shed the virus.
And
Yeah.
what are some other ways that we can like visually see, like, okay,
Then the visual symptoms are not very obvious, I think, when it
So I
comes
mean,
to HIV.
yeah, anyone has HIV, you cannot tell just by looking.
Yeah.
so it's all based on trust,
And testing.
And
No, you get what I mean.
And
Okay, okay.
wearing condoms.
Let's say, that, and like he says, like, like sometimes people when they drunk, they don't ask to wear condom or anything. Yeah, so it's based on trust, lah.
Prevention can happen on different levels, right? So basically, education, which is what we're doing now, getting the message out there to make sure that people are aware of what that's going on. I always tell my patients, hey, before you buy a mobile phone, you go and check all the specs, everything like that, which is the best. Okay, why doesn't it apply to before having sex? So education is one of the important tools, but other than education, sometimes we have a knowledge practice gap. I know this is the way, I've read all about it, but I don't practice it. Then we have to see why, and for each individual, it's different. Abstinence, okay, from casual sex will probably be very important. Okay?
Don't visit prostitutes also, right?
Okay.
Don't cheat on your
Don't
wife.
cheat on your wife.
Yeah.
Or husband.
That first.
Yeah, don't
Then
visit.
that.
Where's the ABCs?
Okay, so
And I just need to know because I think I got it all wrong.
abstinence from casual sex.
B for
Okay, B for being faithful. But here, I like to add on another B, which is behavioral modification.
Which is?
For example, you have your knowledge,
Yeah.
then you have the practice gap. So how do you modify your behavior so that if you've had an infection before, you don't get a new infection? The C
Condoms.
would be condoms, but doesn't mean you hold a condom in your hand, you'll be fine. You have to use it correctly and consistently. The D is the detection. Okay, so if you are potentially at risk or had an at-risk exposure, go for screening, go for testing, and then there's so many avenues to do that nowadays. It shouldn't be a barrier.
Oh, so basically in IJ, I was from IJ Convent Girl, so they were telling us ABCs of safe sex, right? So the lady was like, C for condoms. And then one of the teachers, like she's a bit old, she was just like, no, C for chastity. Because we are Holy Infant Jesus girls, okay? We cannot be engaging in casual sex. Your body's a vessel. Then I'll be like, okay, chill.
Like chastity, like.
What was
Like,
A and what was the A and B?
A was abstinence. B, I don't remember, but I guess it's probably being faithful.
Because I remember that talk, and then I remember like, oh, ABCD, all boys got dirty.
There are vaccinations against two major viruses. Okay, since we're talking about STIs here as a whole and not only HIV, but they're also important. There's vaccination for hepatitis B, which is a virus that you can acquire through sex itself, okay, which can affect the liver. Number one. Number two, there's
What
also
virus is
vaccination for human papillomavirus or HPV,
HPV.
Yes.
which
I had
causes
that.
warts.
Yeah.
Okay, so warts are important because the HPV virus is oncogenic. That means it has the potential to turn things cancerous. And cervical cancer is the top 5 cancers in Singapore for women.
Wow.
With this, it's easily preventable. The good news is that a lot of the young kids nowadays are being vaccinated for HPV in schools. So, but
when
there's
did they start this program?
Yeah.
I think they
don't
started
remember.
in the mid 2000,
That's awesome.
2010 or 2015. I
Bastard,
can't
then what about us?
I probably got vaccinated.
You still
then.
can get it.
So-
is it?
No, I know, but for free though.
Yeah, you still can actually go to a clinic and ask for vaccination. There are various HPV vaccines available, and I think it's important because if something is preventable, okay, it should be done.
Okay, when it comes to testing, for my knowledge, it takes 10 years to show. Is that?
Symptoms.
Yeah, symptoms. 10 years to show symptoms.
Okay, so after acquisition of the virus, there are various ways you can test. Okay, but it can be tested as early as 3 to 4 weeks, depending on the test kit you use.
You wouldn't know you get exposed, right? So every time you engage in casual sex, would you encourage someone to just get tested as well?
Well, I mean, I always advise people to
Or like get tested every couple of
screen.
months?
Okay, let's say before you go into a relationship, rather than go to a relationship, have the sex, and then come and do something because you've discovered something.
But like
Story.
realistically speaking,
Yeah, realistically speaking, it's
yeah,
not possible.
yeah,
Okay.
if it's casual.
So what happens then?
Yeah.
Like, let's say you already engage in casual sex.
I mean, medically we go frequency of partner change. So if there's frequent partner change, you say
Dude, I haven't gotten laid in a long time. Okay?
screen every 3 months or
Alright.
so.
Screen every 3
Yeah,
months.
okay, depending on your
3
partners,
months.
yeah.
Wow, that's
Okay.
A lot of partner changes.
Okay,
screening.
Based on your experience, is it true that people are very hesitant to go and test?
I think I'm biased because of where I work. I mean, people come in and we are always busy. Okay, so I think, but if you speak to your friends or you listen to what people say, is that they are potentially scared because they are afraid that they are told bad news, or they think that they're not at risk.
I feel like some people, or rather I hear it from friends, they are scared because they don't know what to expect when they go to the clinic.
If you go to an anonymous test site, be it a GP or the AFA one at DSC, you register. It's anonymous. They don't take down any of your NRIC or anything like that. You fill up a form, let's say male, Chinese, 30. They do a finger prick test. There will be pre-test counselling, information material. And then after that, they will know the results.
Pre-test counselling, so like they.
So basically, they tell you like, hey, this test, you had your sex a week ago. You're doing a test now. It may not be accurate because this is the window period.
Oh, okay.
And then after that, they tell you, okay, this is negative for now, but we advise you to test a month after the exposure, for example. If you test negative, you still have to be careful because you can get all the other STIs. You test positive, this is just a screening test. You would have to have a confirmation test, which is usually drawn blood rather than a finger prick. But if you're afraid of needles, okay, the HIV program is also running oral test kits. Okay, I happen to have brought one with me, and no needles.
Okay.
Yes, I did that.
No
for-
blood also?
This is not
No
for
blood.
HIV, right? This is for
So
like
this is a
SRT.
test kit for HIV,
Oh,
and you
wow.
can swap the oral secretion in your
Wow.
mouth and the gums.
That is very cool.
You put it into the container, and within half an hour, you will have your result.
And how accurate is that?
The accuracy is more than 90%. Okay, but as I said, this is a screening test. If it's positive, it has to be confirmed. If it's negative, it's most likely negative. And this can be available from the anonymous test site at AFA on Tuesdays, Wednesdays, and Saturday evenings. Or if you walk into the DSC clinic during office hours, you can buy kits directly from the pharmacy without any questions asked.
Okay. And how much is that?
So the kits range in price from $20 to $30 depending on where you buy it for.
$20 to $30.
Yes.
Depending on?
Where you buy it
Where you
from.
buy it
Oh,
from,
okay.
Okay. So I
Not
think,
bad.
as I said, you spend X amount of dollars on an iPhone 14. This is a bit cheaper than an iPhone 14.
Yeah, I
Okay.
agree.
And if, let's say, someone tested positive, what should they do?
Okay, if someone tested
They should
positive,
go for confirmation test.
the first thing is not to panic. Right? There are
Oh, my ex. Hey, yo.
Can you please?
Okay, sorry, doctor.
the first thing is not to panic, not to call your friend and tell everybody about it. But don't panic. Call a hotline that can give you information. And as I said before, the test kits that are available, either this or the finger prick, okay, are mainly screening tests. They have to be confirmed. So we always advise people to go back to where they either bought the test kit from or a site where you can have a confirmation test with blood drawn.
So definitely we should go down to one of the places that you mentioned, like the DSC clinic.
Okay. Anonymous test sites dotted all over Singapore.
Okay.
Information is on the HPU website. Okay. The DSC clinic happens to be a site for the AFA anonymous test site, but the DSC clinic works during operating hours as a named patient, so not there. Okay, so but if you need to do a confirmatory test, the clinic will be where to be. But it's very difficult to do a confirmatory test without being registered as a registered patient, be it anywhere. So you can actually, if you can't get to the site where you got the test kit from, you can visit your any GP and they should be able to do the testing for you too.
Oh, okay. So just to streamline it for people who, like all the DS, ABC went over their head, you can go to any GP.
Yes, you can go
and
to.
you can say, I would like to have a screening test, and then they will walk you through the confirmatory test and all
Yes,
that.
right.
Okay, that's good.
So you have 9 or 10 anonymous test sites.
Alright, okay.
If you test positive, you have to do confirmation.
Okay.
Okay, if you test negative, you have to continue to
ABCs.
be
These.
careful. Okay, and of course, be as safe as you can.
Okay.
Yeah.
Again, if you guys want to buy this, you can go to
Either the DSC clinic during office hours or the AFA anonymous test site during Tuesdays, Wednesdays, and Saturdays.
and it's $20 to $30 depending on where you go. But most importantly, how do we use it?
Should I try?
Okay, so you can swab the insides of your cheeks,
Okay.
and then the upper parts of your
I'm like scared now.
your inner the up
Gum.
between the gums and the
Yeah.
lips. Okay, and then after that you open the container
Ah.
and then you put the kit in
Ah.
and you leave it there until the lines come up.
And in half an hour, you will get your results.
Result, yes.
All right.
Okay, and this can be done in the privacy of your home. Okay, and then there are hotline numbers to call. Okay, that come along with the kit. Okay, in case you are tested positive.
Do you think we'll come to a point in society where like we test before we have sex, similar to like how we do the ART test before we go clubbing?
I personally think it will be because
Yeah.
now, okay, I feel like our generation, hookup culture was okay, but the generation after us, I feel like hookup culture is really a thing.
Actually, not true, because I read statistics that Gen Zs are actually having the least amount of sex according to different age groups. They only talk about sex very openly, but they do not really engage.
And that's the
might
safest
be
form of
true.
oral sex.
So we come to the end of this episode. I hope you guys liked it. Thank you so much, Doctor.
Thank you so much.
For giving us so much information. I mean, you answered all of our questions, and I hope he answered all of your questions. Now we encourage everyone to go and get tested. We will leave all information that we spoke about in the description box below, including the self-test kit.
Yep, where you can get one, when you can get one.
I mean, at the end of the day, just keep safe.
Stay safe.
Stay safe. Wear a condom for men.
Don't engage in so much casual sex.
Correct.
Remember the ABCDs.
And the E.
already.
All boys cock the T.
Our boys got
No,
that.
I'm
I'm just
just
kidding,
no,
I'm just
wrong,
kidding.
wrong. Yeah.
So if you guys have anything you'd like us to talk about, let us know in the comment section below. If not, we'll see you guys in the next episode.
Bye.